Hello, my name's Sarah Church and I'm the Chief Executive of Phyllis Tuckwell. I want to thank everybody in our community for all the support and kindness they've shown over the last few months. I'm going to give you a virtual tour of the hospice here in Farnham today to show you the changes, the big changes we've had to make in the way we're working. But the way that we've done them means that we can still continue to provide really high quality care to people who need us most. This is our reception area where everybody comes in when they come to visit, whether it's patients or members of staff. Normally it's a really bustling, busy, friendly, vibrant area with lots of things to look at and things to buy. At the moment we've had to strip the shelves bare and take away the magazines, and that's to keep our patients and our staff safe and make sure that this is as safe as an environment as it can be. But not everything's changed. Behind me we have our lovely receptionists who make sure that if people do turn up they have a really warm welcome. So I've just come from reception down the long corridor to the inpatient unit, which is where our really poorly patients are. We've made lots of changes to make sure that we can keep them and our families and staff safe. And I'm going to show you what they are now. I'm talking to you for now from the inpatient unit, and here we've created isolation rooms for patients who are showing symptoms of COVID or who are COVID positive to make sure that we keep everybody safe. We also have staff wearing PPE, that's to protect them and to protect the patients. But of course it does create a barrier, it's a different way of working. Normally we're used to holding people's hands, smiling at them, all sorts of human interaction that's much harder when you're wearing PPE. But our amazing nurses have found ways to do that. I'm going to show you a bit more about what we've been doing to try and connect with families in a second. Because we haven't been able to allow as many visitors as we'd normally like, we found other ways to try and connect families together. Our chaplain and staff make sure they spend time every day with each of our patients, looking after them, just spending time with them, praying if that's what they wish. We've also found ways to connect families, so for example perhaps having two pebbles and one stays here with the patient and one goes home with the family, or knitted hearts or other things. We're trying to do as much as we can to make sure that people feel connected at this time. I've shown you around the IPU, but in fact most people want to be looked after at home and want to stay in their homes with their families. So we've come upstairs now so that I can show you how we organise that service. When people phone us up wanting help, it comes through to the advice and referral team in this room, and we're going to go and see what they do now. Our care at home service is coordinated by the community team who are based in this room. They find that GPs and colleagues in the NHS phone in with referrals, and then they will get in touch with patients to find out what they need. During this time we've had to be creative about finding new ways to deliver services, and we're making quite a lot of use of video conferencing. Our home support team that rely so strongly on volunteers to visit patients are now keeping in touch by video, and therapists are delivering specialist equipment to patients' home, dropping it off and then doing a video consultation about how to use the equipment safely. Of course, patients who need hand-on nursing care are seen by our hospice care at home team based at our Beacon Centre site. So this is the room where we normally run group activities, bringing people together to share their experiences and just be with each other. Obviously we've unfortunately had to shut those groups down. We can't run them at the moment. In fact, behind me, what is normally an art room is a place we're using to store nurses' uniforms at the moment and make sure we can keep them safe and well equipped. So here in the Dove Lounge, the fact that it looks really empty doesn't mean that we're not still working. Many of our staff are working from home, and in particular our bereavement team are providing counselling and support and advice to families. Despite the difficult times, it's really important that we continue to provide that service. So now it's time to see behind the scenes. This is our fundraising room, which is normally buzzing and full of creative, energetic fundraising teams running events and the like. We've had to shut our shops and it's really hard to fundraise at the moment, so it looks a very different kind of place at the moment. But those teams are still working hard and we're hoping to bring back our retail teams as soon as we can. Down the corridor we have a skeleton staff in each of the offices making sure that we can still provide a basic finance, HR, comms and IT service to support our frontline staff. We're doing all of this to make sure that we can still safely provide the best possible quality care for patients who need us. Thank you for joining me on the virtual tour of Phyllis Tuckwell. Hope you've enjoyed it. I want to say a really big thank you to you, all of our supporters. It's your money and your donations and kindness that keeps us going, funds us and allows us to continue providing these services. We're really grateful to the government for the money they made available during coronavirus. However, we do still need money, more money I'm afraid, to keep offering this kind of service. I firmly believe we're going to come out of this stronger with new ways of helping patients and providing good quality services. Thank you, because every day is precious.